skin cancer and burns. So what happens when some things kind of go awry with this body system? Starting off with our lecture objectives, we have the glands of the integument system. So you'll need to know the types of glands that we have. They're eccrine, apocrine, and sebaceous. And you'll need to be able to describe each gland in regards to its location, the types of secretions, and the functions that they have. We'll also go over the homeostatic mechanisms of the integument system, so how the integument system maintains homeostasis concerning thermoregulation, protection, and water conservation. Then we'll look at some of the abnormalities that you can find in the integument system. So, given a factor or a situation such as second-degree burn, predict the changes that could occur in the system and the consequences of those changes. Identify the following conditions through their pathophysiology and predicted changes to normal physiological systems related to the integument system, so burns and skin cancers. Summarize the characteristics of the 3 major types of skin cancer. Describe the life-threatening risks of serious burns, and describe how to determine the extent of a burn and whether it's first, second, or third-degree burn. Let's start things off with the glands of the integumentary system. So we have 3 types of glands that you'll find in this system. We have eccrine sweat glands, apocrine sweat glands, and sebaceous glands. This table over here, table 5.1 from your text, is a really good table if you just want a reference to be able to go back and compare and contrast the similarities and differences between the 3 types of glands that you can find. Starting off with the eccrine glands. So these are your eccrine sweat glands. They're considered to be merocrine sweat glands, so they secrete their products via exocytosis. And these are the most numerous types of glands that you're going to find in the integumentary system. So these are found everywhere on the body, but they're the most abundant on the forehead, the palms, and the soles of your feet. So the way that we get sweat from these glands, if we look at our little chunk of skin down here to the bottom right, this little squiggly clump of ducts right here, this is an eccrine sweat gland. And you can follow this duct all the way up through the dermis, through the epidermis, and it's going to actually excrete sweat onto the skin via a sweat pore. Now, sweat is just a hypotonic filtrate of blood. So it doesn't have a lot of solutes in it. It's actually 99% water, but there are some salts in there. So sodium chloride being the most common. I'm sure some of you have been outside for a long period of time and had sweat pouring down your face and actually tasted your own sweat. It does have that salty taste to it because there are salts in it. So in addition to the water and the salts, we also have dermacidin, which is a naturally produced microbe-killing peptide that comes out in your sweat. We also have various metabolic wastes that are going to be in the sweat, and your normal sweat is actually pretty acidic, so it's going to have a pH of between 4 and 6. And the main role of these sweat glands, the eccrine sweat glands, is to thermoregulate. So it's to prevent your body from overheating. So when you start to get really hot, your body's going to dilate your blood vessels and cause a significant amount of water loss through these sweat glands to help bring that temperature back down. These are also the sweat glands that are involved in what you would call the cold sweat. So if you're under some sort of emotional stress, maybe you're really nervous and you get sweaty palms. So when you actually start to experience a cold sweat with your eccrine sweat glands, you'll first feel that sweat on your palms, then your feet will get a little bit sweaty, then it moves to your armpits, and then it'll move to the rest of your body. So instead of it actually acting to try and cool you down, it's secreted in these specific places when you're under some sort of emotional distress. Now, our second type of sweat gland is an apocrine sweat gland. You'll find these sweat glands in your armpits and around the genitalia. And instead of secreting its products to the skin directly through a sweat pore, these sweat glands usually empty into the upper part of a hair follicle, and then the product comes out of that hair follicle. So it doesn't have its own sweat pore that actually empties onto the epidermis. These glands are larger than eccrine sweat glands, but they're still considered merocrine sweat glands, So the products are still secreted via exocytosis. The sweat from these glands is also a hypofiltrate from blood, so it's mainly water with a little bit of salt. But in addition to that, we're also going to find proteins and lipids in the sweat from these glands. Oddly enough, this sweat is odorless, and I'm sure you're thinking to yourself, well, usually, if you have a lot of sweat in your armpits, you smell some sort of body odor coming from somebody, especially because these glands begin to kind of work during puberty, which is usually when that body odor comes into effect. But it's actually not the secretion that you're smelling. So the sweat from these glands is odorless, but the bacteria on the skin in these areas likes to break down the proteins and the lipids that are secreted with it. So remember, those proteins and lipids are specific to the apocrine sweat gland products. So that's what actually stinks. That's what causes your body odor, is the bacteria on the skin in these areas breaking down those proteins and lipids. So unlike eccrine sweat glands, your apocrine glands do not function as a thermoregulatory mechanism. So you don't sweat in these areas in order to help bring that body temperature down. It's actually theorized that these are more pheromonal, which would kind of make sense because the function of these glands begins at puberty. The production from these glands is actually increased with sexual foreplay, with the activity is increased with the phases of the menstrual cycle. So as that menstrual cycle changes and kind of the female hormonal cycle ebbs and flows, you will have increased and then reduced activity from these glands. And secretions from these glands have been shown to trigger a response in other members of the same species. So it is quite possible that your apocrine sweat glands are pheromonal in nature. We also have two types of specialized apocrine sweat glands. You have your ceruminous glands, and your mammary glands. So oddly enough, your mammary glands are a type of sweat gland. So your ceruminous glands produce what is called cerumen, which is just a waxy substance. So think about where on the body you normally would find a waxy substance. It's going to be in your ears, your ear canal, your earwax. So if we look at this ear canal right here, this would be a ceruminous gland. And this would be a ceruminous gland. And so it's in the lining of the external ear canal. So that cerumen is secreted. It mixes with secretions from sebaceous glands that are found in the ear, which we'll talk about sebaceous glands in a second. And that is what actually makes your earwax. Then our mammary glands, which are found in our mammary tissue, these, even though it's an apocrine sweat gland, these are responsible for secreting milk when a female is lactating postpartum. So our third type of gland that we'll find in the integumentary system is a sebaceous gland. So your sebaceous glands don't secrete sweat, they secrete oil. Take a second, think about where have you potentially found any oil on your body before. And I'm sure most of us have at some point experienced oily hair. So your sebaceous glands secrete oil directly into hair follicles. So they are individually associated with hair follicles. And the oil that they secrete is referred to as sebum. So These glands are still found everywhere except for the palms of your hands and the soles of your feet. That's just where we find our American sweat glands. Our eccrine sweat glands are on the palms of our hands and the soles of our feet. But sebaceous glands are still found everywhere. So the point of the sebum is to help soften and lubricate the hair, but it also helps to waterproof the skin. So keep some water in the skin and keep your skin from getting weird and soggy at the slightest touch of water. It's also bactericidal. So let's take a look at our little chunk of skin here. So this gland that's specifically associated with the hair follicle, these glands associated with this follicle, these are the sebaceous glands. And if we look at this actual histological image, here we have a hair in a follicle, and you can actually see this sebaceous gland right next to that hair follicle that's going to empty into that hair follicle up here. And that's how we get our sebum secreted onto our skin through our hair follicles. So we've talked about all of the different layers of skin. We've talked about the different components and structures that make up our skin. But what exactly is the purpose of the skin that we have? So the main function of skin is going to be protection. And that comes in three forms. It acts as a chemical barrier, a physical barrier, and a biological barrier. So in regards to being a chemical barrier, you have the various skin secretions and that melanin. So the melanin, or that pigment that's produced from the melanocytes, acts as a barrier to the UV radiation from the sun. It also acts as an acid mantle, those secretions. So I mentioned the pH of the eccrine sweat is usually between 4 and 6. So the acidity, or the low pH of those secretions, helps to decrease the rate of bacterial growth. We also have defensins that are part of our skin, and that's a natural antibiotic that is secreted from your skin cells. And those defensins actually act by punching holes in bacteria that they encounter. So that's pretty neat. When we look at how it acts as a physical barrier, we have that really thick layer, that stratum corneum, that has 20 to 30 layers of those dead keratinocytes. So the dead keratinocytes in themselves act as a physical barrier to prevent things from getting into our body just from the skin surface. We also have those water-resistant glycolipids that come up from some of the bottom layers of the epidermis, and those act by blocking the diffusion of water and water-soluble substances and keeping them between our cells, preventing the loss of water from the body and preventing entry of water that's not already in the body to in the body. We do have some substances that can cross these layers, though. So we have lipid-soluble substances such as oxygen and carbon dioxide, and then we have vitamins A, D, E, and K that can cross this physical barrier. You also have some organic solvents, so acetone can make it past, paint thinner, certain dry cleaning fluids, and they're able to make it past the physical barrier because they actually dissolve the cell lipids that are present. They'll dissolve those glycolipids and just make their way through the area between your cells. We also have heavy metals like lead and mercury that can make it through, which is why I don't know if any of you have ever seen an old thermometer made of glass that had mercury in the middle, but they always said if you broke one of those thermometers, do not touch the mercury that pours out of the thermometer because it can lead to mercury poisoning because it's absorbed through your skin. We also have certain drugs that can be absorbed through your skin, like nitroglycerin, which is a cardiac drug, and various seasickness medications. So in addition to acting as a chemical barrier and a physical barrier, it acts as a biological barrier. So we've talked about dendritic cells in our epidermis and macrophages in our dermis, and both of these guys are immune cells. So we have immune cells that are right there on the surface of our body, in our skin, that are there to patrol and engulf anything that shouldn't be there. And once they encounter something that shouldn't be there, they go on to our lymph nodes to initiate the appropriate immune response. So we have a few more functions in addition to protection. And of course, we've already mentioned thermoregulation. So we have insensible and sensible perspiration. So insensible perspiration, at temperatures below about 88 degrees Fahrenheit, your body just naturally secretes some water throughout the day. It'll secrete around 500 milliliters of water, which is about half a liter of water per day. Then we also have sensible perspiration, and that's what happens when you are really hot outside and you actually have sweat that you can see pouring down your skin. And that's your blood vessels dilate, your sweat glands increase activity, and you go from naturally secreting 500 milliliters of sweat to up to 12 liters of sweat, 12 liters of water leaving your body. That's up to 3 gallons of water that you can lose just from sweating in one day. So that's why hydration is so incredibly important if you're working outside or doing any sort of sporting activity outside. Drink that water. The skin also acts as cutaneous sensation receptors. So we have exteroreceptors, and we've already discussed some of those in our previous lecture. You have your light touch receptors, or your Meissner's corpuscles from the papillary layer of the dermis. Then we also have our lamellar or Pacinian corpuscles. Those guys are found in the reticular layer of the dermis, and they're responsible for sensing deep pressure. The hair that you have on your arms, those follicles are able to sense wind and actually able to sense changes in the air. And then we also have free nerve endings that are present throughout the skin, and that is what is going to sense pain. Then another function is actually metabolism. The biggest metabolic product that comes from the skin is the skin sensing the sun and converting cholesterol to the precursor for vitamin D. That precursor for vitamin D is going to make its way to your kidney, where it is converted to the active form of vitamin D. And without that active form of vitamin D, we cannot absorb calcium. Calcium is extremely important for bone health and other metabolic processes, and without it, we would be in a very bad way. And we cannot absorb calcium through our intestines if we do not have the active form of vitamin D. So we get that precursor for vitamin D from cholesterol when our skin senses the sun. So that's why they say if you are vitamin D deficient, or even if you're low on energy, you need to go outside and spend some time in the sun. And that's because the sun genuinely helps our body with conversions from cholesterol to vitamin D. Your skin also acts as a blood reservoir. So the dermal blood supply, remember that dermis is going to be vascularized. That dermis holds 5% of the entire blood volume that you have in your body, just in that thicker layer of your skin. So if you have other organs, other internal organs that are working really hard and need more blood, the nervous system is going to constrict the blood vessels of the dermis and shunt the blood from your skin to your general circulation so that the organs that need that extra oxygen supply and need extra blood will be able to get it from your skin. And then lastly, our last function of the skin is excretion. So we're going to eliminate nitrogen-containing wastes in our sweat. So that's ammonia, urea, and uric acid. You can find all 3 of these in sweat, which is also going to contribute to the low pH of sweat. Most of the ammonia, urea, and uric acid in our body, though, is going to be secreted in urine. But some of it is secreted or excreted through our sweat. We also have your skin playing a huge role in water and sodium chloride loss when profusely sweating. So now we know the basic functions of the skin and the glands that make up our integumentary system. So let's take a look at what happens when some of these basic skin cell types start multiplying uncontrollably and things go a little bit awry. So let's look at skin cancers. So 1 in 5 Americans will be diagnosed with skin cancer at some point. So it's the most common type of cancer that's encountered. And UV radiation, exposure to UV radiation, is the biggest risk factor for developing skin cancer. So remember that UV radiation is going to actually damage the DNA in our skin cells. So we have 3 main types of skin cancer. The first one is a basal cell carcinoma, which is this top image right here on this gentleman's nose. Your basal cell carcinoma makes up 80% of skin cancer cases. Although it is the most common type of skin cancer, it's also the least malignant. So it's the least likely to spread to other areas and start causing real health problems. It presents itself as kind of a shiny, dome-shaped nodule, and eventually it'll have a centralized ulcer. So right here, we see this shiny dome-shaped nodule, and then this indention or this ulcer in the center right here. So what a basal cell carcinoma is, it's when the cells from that stratum basale, so the bottom layer of our epidermis, actually start to invade the other tissues around it and the other layers of the skin around it, push up through the other layers of the epidermis. And remember, it's the least malignant, so it's the least scary type of skin cancer that you can get, which is great because 99% of people that have a basal cell carcinoma fully recover with surgical incisions and actual removing of the nodules from the carcinoma. The second type of skin cancer, the second most common, is a squamous cell carcinoma. So squamous cell carcinoma is going to present itself as a scaly, reddened papule. So it looks quite different from that basal cell carcinoma. And we get a squamous cell carcinoma when the keratinocytes of the stratum spinosum start to rapidly divide and reproduce uncontrollably. So a squamous cell carcinoma can actually experience rapid growth and metastasis, but you have good chances of a complete cure if you undergo surgery or have radiation treatment. So radiation isn't necessary for a basal cell carcinoma, but it may be necessary for a squamous cell carcinoma. And you'll be most likely to see these reddened, scaly papules from a squamous cell carcinoma on the head and the hands. So you can see it on the scalp and the ears or the hand. Type is the melanoma. And melanoma is the worst skin cancer that you can get. So that is the cancer of melanocytes. So your melanocytes start to uncontrollably replicate. This is the most deadly form of skin cancer that you can have, although it only makes up 2 to 3% of total skin cancer cases. And what makes melanoma so bad is it is resistant to chemotherapy. So it'll begin wherever there is pigment already present, and it is highly metastatic, so it can spread very quickly. So you'll find a patch of brown or black skin that looks like it's spreading a bit, and it will spread from that patch of skin to your lymph nodes and your blood vessels and move to other parts of your body and start to take over. But now the question is, regarding melanoma, how do you know if it is melanoma, a skin cancer that you should be concerned about, versus a mole? So let's take a look at our next slide. So melanoma or mole. The American Cancer Society has A, B, C, D to help you decide whether or not you're looking at melanoma or a mole. So that A stands for asymmetry. So these first two images, this is a normal mole. It looks fairly symmetrical on either side. Our melanoma here has spread out and does not look symmetrical. This side does not look the same as the other side. So A is asymmetry. Then we have B for the border. Do we have nice clean edges, like what you would see in a mole? Or do we have an irregular border, which is what would be seen in a melanoma? Then we have color. So C for color. Do we have one color, like what would be in a mole? Or do we have varying shades? Do we have different colors that are present in the area? Like we have darker brown or black over here, spreading to a lighter brown and even almost yellowy on the edges right here. Then we have D, or diameter. So if it's larger than 6 millimeters, or larger than a pencil eraser, it's more likely to be considered melanoma over just a mole. So the ABCD from the American Cancer Society is just a quick little mnemonic to help you remember the criteria for determining if you have a mole or could it potentially be something more. So we also have burns, another type of injury that the skin can encounter. And a burn constitutes any sort of tissue damage from extreme heat, electricity, or even certain chemicals. And your burns are going to be classified according to the severity of the burn, or in other words, the depth of the burn. How deep does that burn go in the layers of the skin? So we have a first-degree burn, and that is something that has only damaged the epidermis. So we've just burned that top layer of skin. We have redness, we have some swelling, and you'll be able to experience some pain with these burns as well. But it only takes about 2 or 3 days, and usually they are completely healed. So a sunburn is actually considered to be a first-degree burn. Then we have our second-degree burn. So that's going to damage the epidermis and the upper dermis. So that papillary layer, maybe the beginning of that reticular layer, but it's not very, very deep. It's similar to a first-degree burn, so we'll see that redness, that swelling, that pain, but we also have blisters. So I don't know if any of you have ever experienced a sunburn that was that bad that actually gave you blisters. Well, you had a second-degree burn from that sunburn. Now, these are going to take, your second-degree burns are going to take much longer to heal. So it takes about 3 to 4 weeks to heal from a second-degree burn versus just a couple of days with a first-degree burn. But your first and second-degree burns are both considered to be partial thickness burns. They don't go all the way through the layers of the skin. We just have the epidermis damaged, or the epidermis and that upper dermis. Whereas our third-degree burn is going to be a full thickness burn, a full skin thickness burn. So this is going to present as gray to white, a grayish white color, or it could be bright red or even black. And because we've gone all the way through the layers of the skin, so every layer has been burned, we've actually burned off those nerve endings. So the nerve endings have been destroyed. So you won't experience any pain after a third-degree burn. Your third-degree burn is really dangerous, though, because when you go through all of those layers of skin, remember, the skin helps to keep water in our bodies, to keep fluids in our bodies. So if we go through all of those layers of skin, we're actually getting rid of our protection of keeping that water in the body. So you're going to experience a lot of fluid loss from a third-degree burn. So it's usually recommended to have some sort of skin grafting done at the time to prevent more fluid loss. So if we look at these pictures right here, our first-degree burn on these fingertips, they're just red. If we move down to the base of the palm here, you see this large blister that is formed. That's our second-degree burn. And then our 3rd degree burn over here. We've gone through all of the layers of our skin. We can actually see all of the colors here. We have grayish white skin down at the bottom towards the heel of the foot. We have black burned skin all the way around the borders of this 3rd degree burn. And we also have that cherry red color as well. So I said, when you have a 3rd degree burn, you can experience a lot of fluid loss, which is where things get scary. So we do have some critical situations where these burns, even a 2nd degree burn, they're no longer just burns that you can wait to heal. They need immediate treatment or things could turn critical with that fluid loss. So if you have 25% of your body that experiences a 2nd degree burn, or 10% or more of your body that experiences a 3rd degree burn, both of those will cause a huge loss of bodily fluids. And then if you have a 3rd degree burn on your face, hands, or feet, that is also considered to be a critical situation. So when your body oozes that fluid that is coming from your tissues that have been burned, you're losing your proteins and you're losing electrolytes. And you, depending on how much fluid, not even blood, just fluid is lost because of these burns, your bodies can actually go into circulatory shock from loss of blood volume from losing these fluids. Now I said 25% or more for a 2nd degree or 10% or more for a 3rd degree burn is considered critical. Well, how do we figure out what percentage of burn we're experiencing? So that is where the rule of 9s comes in. So your body is divided into 11 areas, and each area is considered to be 9% of your body, or 9% of your skin. So your head has 9% of your skin. Your arm has 9%, either one, 9%. Then we have 18% on the front, so I guess 9 more in the thorax, and 9 more in the abdominal area, and 18% on the back. Our legs are going to be longer than our arms, so each one has 18% front and back. And then our genitals just make up 1% of the potential burn area. So this is just a quick reference for if you see a patient come in, their entire right arm is experiencing a 3rd degree burn with just the right arm, you pretty much have a critical situation there because you have 9% of the skin on the body that has been burned. So we're almost reaching that 10% or more type situation. So that's actually all that we have for today's lecture. So remember, we went over the glands of the integumentary system. So we have 2